My name is Richard Benjamin, and I'm a psychiatrist from Tasmania. About 25 years ago, I met someone who had been repeatedly diagnosed with schizophrenia. She'd been in and out of institutions for nearly 2 decades. The only problem is, she didn't have schizophrenia. She'd been very badly abused at the hands of her caretakers, and her problems had been totally misunderstood. In fact, all along, she had complex PTSD. This understanding and the treatment that followed totally changed her life. People are still given diagnostic labels using our modern classification systems, and these are often very helpful. But often they just group symptoms together and don't look at what it might have gone before. Seen through the eyes of trauma-informed care and practice, however, a new cutting-edge mental health paradigm, people are asked what happened to them, not what is wrong with them. And looking at it this way, it can be seen that many people with severe mental illness have suffered abuse and trauma, and they need different approaches to care and treatment to heal. Just 2 years ago, with co-editors Joan Halliburn and Serena King, we published one of the first multi-authored textbooks in the world on this topic, Humanising Mental Health Care in Australia, a guide to trauma-informed approaches, with Routledge. This over 400-page textbook with 30 chapters and 44 authors covers trauma from many perspectives and has been written in a very accessible style by a diverse group of national and international trauma experts, including Sandy Bloom, Russell Mears, Alexander McFarlane, Louise Newman, Christine Courtois, Sathya Rao, and Bryn Grenier. It covers theory very broadly, as well as trauma in specific populations like infants, Aboriginal Australians, and refugees. The book also covers a wide range of individual treatment approaches, starting with the increasingly well-recognised phase-based approach, through cognitive behavioural approaches to psychodynamic and somatic treatments, as well as meditation and yoga. The last section focuses on organisational approaches, for example on residential services for children and young people, on inpatient services for adults, and approaches for Defence Force personnel. The 5 critical principles of trauma-informed care and practice, safety, trustworthiness, choice, collaboration, and empowerment, are discussed specifically but also resonate throughout the book, as does a focus on healing within a safe and trusting therapeutic relationship. As we recover from the devastating effects of an international pandemic, and as we approach the formal recognition of complex PTSD as a diagnosis in ICD-11 on January the 1st, 2022, there is a deep need to think about trauma and healing, and this textbook is a handy single-volume resource manual on the area. To quote one of the book's reviewers, Dr. Peggy Brown, former CEO of the National Mental Health Commission of Australia, every mental health clinician, health policy maker and administrator in the country should read Humanising Mental Health Care in Australia. No matter what your background, if you're interested in how to improve the delivery of compassionate health care, I guarantee you will find true pearls of wisdom in this book.